Hello and welcome to the 2017 open enrollments for T Bird Restaurant Group and Outback Steakhouse. This program is designed to give you information about what benefits are available to you as a full-time employee with T Bird Restaurant Group. The first part that we're going to start out with is that if you have questions through this process, you can reach out to the team at Highland and they can help you with any questions you have via their customer service number. You're also free to email the account management team, Joe Mowry or Kate Baum, at the email addresses below. This year, there are a lot of changes to our benefit program, so we wanted to take time and communicate those to you. First off, it was very important that we set up some goals for the overall benefit program. Those goals included benefits that are available to everyone, and we wanted to have similar plans across all employees that are eligible. On our medical and dental programs, we wanted to have a national network to meet the needs of employees as they travel. And we wanted our program to align with the overall growth and strategy of the company. We wanted folks to have access to data so that it allow us to make good decisions for the benefit of everyone. What this means to you is that effective January 1st, Kaiser and HealthNet will be replaced by United Healthcare. This video should coincide with your open enrollment, so if you have questions during this time, make sure you get them answered and make sure you complete your form. Open enrollment begins November 14th and goes through November 30th for effective date of January 1st. So we're going to take time to review the benefit guide and the benefits therein, as well as the enrollment form. And just a few notes to make sure that you get your benefit guide enrollment form completed and you give it back to your manager by November 30th. You should have received a benefit guide that looks like this, where there's pictures on the front and it says T Bird Restaurant Group and Outback Steakhouse. If you did not, make sure you get with your manager. On page 2, we talk about how you reach Highland, as well as we give you information on all the carriers, their toll-free numbers, as well as their websites, and where they're located on in the benefit guide. You also have the ability to go to the Group Video Benefits Meeting website that includes general information, as well as informational videos about all parts of your benefit program. On page 3, we talk about the overview of the benefits and the changes for T Bird Restaurant Group. On the medical side, as we said, the current Kaiser and HealthNet plans will be replaced by the 4 plans offered from United Healthcare. All eligible employees will have the opportunity to enroll in any of the 4 plans. It's important to note that these medical plans are Choice Plus PPO plans, not HMOs. This provides you with more flexibility when accessing care, and it means you have out-of-network benefits, as well as no referrals needed to see a specialist, nor do you declare who your family doctor is. The dental plans will remain through Assurant. There is a current PPO and DHMO plan, and we're going to replace that DHMO plan with a new low-cost PPO. The vision plan will be replaced with Anthem Blue Cross will be replaced by VSP, and the life insurance, as well as the disability plans, will be replaced by Mutual of Omaha. Voluntary plans like critical illness, accident, as well as LifeLock, pet insurance, all be offered as well, and be sure to check those out. Payroll deductions that will start after January 1st will be taken for any of the insurances that you elect, and these will be done over 26 pay periods per year instead of 24. So what you need to do is review the benefit guide, fill out the enrollment form, and then make sure you get your enrollment form back to your manager by November 30th. To be eligible for health insurance and the other welfare plans that we offer, you have to be full-time, which means either hired as a full-time employee or measured over 12 months with 130 hours per month average. When you make your annual elections, it's important to note that these elections will last for 12 months. The only way you can change those elections if you have a qualifying event. Something like a marriage, a divorce, a birth, or an adoption. And if you have a family status change like these, you must let us know within 30 days by either letting your manager know or reaching out to HR. Your dependents are also eligible to be covered under the medical, dental, vision, voluntary life, accident, and critical illness plans. And for the most part, they can be on plans up to age 26. But some of the plans may vary, so make sure you check the individual documentation. It is your responsibility to provide the Human Resource Department with proof of your dependent's eligibility. If you don't provide required documentation, your dependents may not be covered, so make sure you take care of that. The website resources give you the ability to view videos as well as download and documents that support your benefits program. Things like your medical plan overviews, how the health savings account works, the dental plan overviews, all that's available at the meeting.videobenefitsguide.com/T Bird Restaurant Group. On page 6 of your benefit guide, we talk about the different health insurance options that are now available to you through United Healthcare. They range from a new plan, an HSA, all the way up to the Choice Plus PPO 474. And we'll take a second now to look at some of the details of each plan. The 474 plan has low copays to see the doctor, has low copays to see the urgent care or emergency room, a 3-tier prescription drug card, and then low copays to go in the hospital for inpatient or outpatient services. The maximum out-of-pocket on this plan is $2,500, and it does include out-of-network benefits if you need to go out-of-network. The 525 plan has higher copays to see your doctor or specialist, slightly higher copays to go to the urgent care or emergency room, the same prescription drug tiering, and then a $1,000 deductible that must be met before inpatient or outpatient services are covered. And then after that, United Healthcare pays 80% and you pay 20%. Again, this plan also features out-of-network benefits. The 1328 has slightly higher copays again, $25 and $50 to see the doctor. Urgent care is $125, the emergency room is $250. And then if you go into the hospital to have services done, there's a $3,000 deductible that must be met. And then United Healthcare pays 70% of covered charges. You pay 30%. Your maximum out-of-pocket on this plan is $5,000 individual, $10,000 family. New this year is the AJ34 HSA plan. This is a high deductible health plan, and that means that there's a $2,600 deductible that needs to be met before the insurance kicks in. After the deductible is met, then the insurance pays 90%, and the maximum out-of-pocket individual is $3,600, $7,200 family. You can see down here the costs per payroll for each of the plans, and again, the pay period, the cost will be taken out over 26 pay periods. So here's how an HSA works. If you elect the AJ34 high deductible health plan, you're eligible to open up an HSA. An HSA is a health savings account, and that account allows you to take money tax-free and put it away for future use for any medical expenses you might have. If you're older than 55, you can make an additional contribution, but every year you can put away up to $3,400 per employee or $6,750 for employee and any dependents. If you leave the company, the HSA is portable, meaning you can keep your HSA even if you change jobs, medical coverage, or make other life changes. This tax-exempt account is established for the purpose of paying for the individual and his or her spouse or dependents' medical care costs. You do not need to submit expenses for reimbursement. You will receive a checkbook and or a Visa card to access the funds in the HSA account. There are limitations to what you can use the HSA funds for, so please make sure to read up on what those are. And for more information about HSAs, go to the Video Benefits Guide website to listen to those as well. Here's an example on page 8 that talks about the different ways that you can use your HSA funds. Make sure you check this out and see if any of these apply to you, as this consumer-driven healthcare path is a great path for those that are looking to save money on their healthcare costs. On page 9, we talk about the dental programs that are provided through Assurant. This year we're going to feature two plans, the base PPO plan and the premium PPO plan. On the base plan, you'll see that for type 1 preventative services, there's 100% coverage in the network. That means your cleanings are free. If you need more work done, basic services like restoratives, endodontics, periodontics, fillings are all covered at 80%. You pay 20% after a $50 deductible. And then major services are covered at 50% after the same deductible. Every year, you get to use $1,000 of assurance money to help with your dental needs. Keep in mind that the benefit does change out of the network, so we encourage you to utilize an Assurant PPO provider. You can check for providers at the carrier's website on page 2 of this guide. The premium PPO has 100% coverage for cleanings in and out of the network, and then pays for 90% of basic services, you pay 10%, and 60% of major services, you pay 40%. And orthodontia is covered as well, 50%, and then you have a $1,500 calendar year maximum benefit. On the bottom of page 9, you'll see the payroll deductions for these two plans. Again, we recommend you that you use an in-network provider. So make sure you check the website and or your provider to make sure that they are a contracted provider with Assurant. New this year is our vision coverage with VSP. VSP is one of the largest vision providers in the country, and it consists of optometrists, ophthalmologists, opticians, and optical retailers. You'll have a copay for your exam frames and lenses, and then allowance for contact lenses if you so choose. We recommend that, again, that you stay in the network. Should you go out of network on the vision program, there is a reimbursement that's available. For life and accidental death, there's two programs. T Bird Restaurant Group offers a Mutual of Omaha life and AD&D program at no cost to the employee, as long as you're a full-time eligible employee. For those in management, it's a $25,000 benefit, and it's a $10,000 benefit for all other full-time employees. If there's an accidental death, that's equal to the life benefit, and as you age past 65, the benefits do reduce. Make sure on your enrollment form you write in who your beneficiary is if you are a full-time employee. Voluntary life insurance is provided by Mutual of Omaha and is available to you if you want additional life insurance above and beyond what the company offers you. It's available in $10,000 increments up to the lesser of 5 times your annual earnings. Your spouse and children are eligible to get benefit as well. On page 12, we take a look at the voluntary life insurance deductions, and as an example, you can see that if you were a 40-year-old person and wanted $50,000 life insurance, it would cost you $3.74 per paycheck. A $10,000 benefit for your children is 92 cents, and if you're electing coverage for your spouse, they use your age. Make sure that if you elect life insurance, you need to provide detailed information for all beneficiaries. Full name, birth date, and social security number. On page 13, we talk about the short-term disability benefit provided by Mutual of Omaha. This benefit is a 30% of weekly earnings benefit to a maximum of $1,000, and the benefits kick in after a 7-day elimination period. In the state of California, you can see that there's already a benefit that's provided by the state. So this benefit is designed to make those folks whole who wouldn't be able to survive on what the state of California provides them. If my weekly income was $800, I would collect $440 from the state of California and $240 from Mutual of Omaha for a cost to me of $12.52 as an example. Long-term disability is provided by Mutual of Omaha as well, and this is available to you, and it provides a 60% monthly earnings benefit up to $5,000 a month. The elimination period is 360 days, so it picks up right as short-term disability ends. The benefit lasts until your Social Security normal retirement age. For most folks, that's between the ages of 65 and 67. Right down here, you can see and follow along what your monthly income would be, what your benefit would be, and then if I continue to use the 40-year-old person, it would cost me $9 a paycheck to get long-term disability coverage. So, very affordable. The next benefit that we're going to talk about is voluntary critical illness on page 15. Voluntary critical illness pays a benefit if you are diagnosed with one of these conditions. Things like heart attack, stroke, heart valve surgery, coronary artery bypass all provide a benefit if you get diagnosed. Cancer is covered as well. Invasive cancer is paid at 100% benefit, and carcinoma in situ is paid at 25% benefit. That's commonly known as skin cancer. For you and your spouse, the minimum amount eligible to elect is $10,000, and the costs are right down here. So continue with my 40-year-old example. It would cost me $5.77 for me to elect critical illness for myself. So a great way to offset those benefit costs if I have to go in the hospital. Accident insurance is offered by Mutual of Omaha as well. This benefit pays a benefit if you have to go to the emergency room or seek care due to an accident. You have to seek treatment within 72 hours, but then the benefit kicks in and pays an admission benefit if you're admitted to the hospital, an emergency room benefit, an urgent care center benefit, initial physician office visit, as well as a per day benefit if you're in the hospital for more than one day. Cost for this plan is $6.01 per paycheck, and it's available to you, your spouse, and kids. We're pleased this year to offer LifeLock identity theft protection. The LifeLock benefit program searches over 1 trillion data points every day to identify potential threats to your identity. 2 levels of coverage are offered, the LifeLock Benefit Elite and the LifeLock Advantage. The LifeLock Advantage does offer additional benefits, so make sure you check that out. But it starts at a very affordable $3.92 per paycheck. Hyatt Legal Protection is also offered now. The Hyatt Legal Protection gives you an unlimited number of personal legal matters and consultations with attorneys, all for one low price of $10 per paycheck, $10.38 per paycheck. Everything from estate planning to document review and family law, immigration assistance, elder law matters, real estate, document preparation, traffic offenses, personal property protection, financial matters. There's a long list of services covered by this. We encourage everybody to take a look at this program. It's a great program. New this year as well is nationwide pet insurance. Pet insurance is being offered for those that have a cat or dog they'd like to have coverage for, because vet bills can be very expensive. Costs start at about $10 a paycheck for the wellness program and then go up from there, and they vary by breed and age. All you have to do to sign up is call the 800 number there, and they'll give you the information once they hear what kind of pet you have. The Employee Assistance Program is a free benefit for you, your spouse, and any eligible dependents, as long as you're a full-time employee, and provides assistance for you with a counselor that can help you understand things like legal and financial stress, family relationships, healthy lifestyles, work and life transitions. There's a toll-free number to access this, and we recommend that you keep this number handy in case you need their services. All services they provide are free unless they refer you to somebody for in-person treatment. So now we're going to take a look at your enrollment form. The enrollment form is 3 pages long. This is the first page. It starts with the employer name, which should be T Bird Restaurant Group. The employer zip. This helps us identify what store you work in. And then you're going to complete your first, middle, and last name, your social, date of birth, address, gender, home phone, email address, and effective date of coverage, which for everybody during open enrollment should be January 1st, 1/1/17. It's important to put in here your hire date. If you don't know, please ask your manager, and they'll look it up for you. We also highlighted the location code. Ask your manager what your location is, or ask them to complete it for you. As you go through the product selection areas, you'll see that for life insurance, it's paid for by the company. And then it goes into medical plan. And you simply check yes or no to what plan you would like. And then who you want on the plan, yourself, your spouse, and kids, or all of them. The corresponding payroll deduction is over here to the right. If you decide to waive coverage, which means that you don't want any of the health insurance, that's fine. Just make sure you sign and date right here and give us a reason why you're waiving. Remember, those that waive coverage may face penalties from the IRS for not having health insurance. On page 2, we talk about needing your information. If you elected the HDHP, then you can elect an additional amount to come out of your paycheck and go into your HSA account. Then, dental, selecting either the premium or base plan. If you don't want the plan, just check no. The vision, voluntary life. If you elect voluntary life, indicate the amount that you want and the cost right here. Spouse voluntary life, child voluntary life, long-term disability, critical illness, accident, and LifeLock. And then on page 3, the legal plan, and then the pet insurance you're going to call to enroll. All employees need to complete their beneficiary information with a first and last name and at least a relationship and a phone number. It's okay if you don't know a date of birth. If you're putting your spouse or your kids on the programs, that's fine. We need their first and last name, their social security number, their gender, and their date of birth. Once you complete the form, put your full name down here and then sign and date. So the action steps we're asking everybody to take now are to take their guides and forms, review them, complete the form, and turn it in to your manager by November 30th. Your manager will then turn around and once he or she has completed or collected all the forms, send them to Nicole Milnick at corporate. Keep in mind that delaying this process impacts the entire group since we have a lot of new coverages. Make sure if you have any questions, you reach out to Nicole at corporate or Joe, Kate, or the customer service team at Highland. Thank you.